Hi doctors, welcome back to the new episode of our A to Z series, where in each episode alphabetically we discuss one of the most repeated previous year topics of INI-CET, NEET PG and FMGE. And our today's episode is episode D, where D stands for dermoid cyst. So let's begin our today's discussion and solve some MCQs. Our first question is, a 5-year-old boy presents with a small nodule on the sclera as shown in the image. What is the likely diagnosis? Option A, pterygium. Option B, pinguicula. Option C, dermolipoma. Or option D, dermoid cyst. So which option do you think is the correct one? Well, yes, option D, dermoid cyst is the correct option. In this case, it is a benign, non-cancerous tumor that can occur on or near the eye, a development abnormality in which certain types of cell are misplaced during fetal development. So let's discuss about the common affected locations. They are at limbus, over cornea, over sclera near limbus. Most commonly it affects inferotemporal quadrant. Now let's talk about the appearance. It is a small round nodule that is usually present at birth or shortly thereafter, may be slightly raised and flesh colored. When we talk about the symptoms, dermoid cysts are usually painless and does not affect vision unless it grows large enough to interfere with the normal movement of the eye. The treatment of dermoid cyst depends on the size. Small dermoids may not require treatment, whereas larger dermoids may be surgically excised if they are causing symptoms or affecting vision. So let's move ahead and discuss our next question. What is the preferred management of angular dermoid cyst? Option A, surgical excision. Option B, radiotherapy. Option C, antibiotics. Or option D, intralesional steroids. Well, yes, option A, surgical excision is the correct option. Dermoid is a loose term given to cysts lined by squamous epithelium occurring in various parts of the body. Sebaceous cysts are lined by superficial squamous cells and should more accurately be called epidermoids. Angular dermoids are divided into two subtypes. First, we have external angular dermoids, and this is the most common type of dermoid. Second, we have internal angular dermoid. It's present in relation to frontozygomatic suture. It includes painless swelling. It's often soft, smooth and non-tender. CT is done to rule out dural attachment. So here is the last question for our today's discussion. A farmer presented to the outpatient department with a swelling over his palms as shown in the picture. A few months back he got injured with a thorn. What is the presentation given? Option A, amblyomblastoma. Option B, embryogenic dermoid. Option C, sequestration dermoid. Or option D, implantation dermoid. So which option do you think is the correct one? Well, yes, option D, implantation dermoid is the correct option. So what is implantation dermoid? This is an acquired condition that occurs as the result of implantation of epidermal fragments into the dermis by a penetrating injury. The epidermis continues to grow and forms a cyst lined with stratified squamous epithelium, and this is filled with keratin. Histologically, the inclusion epidermoid cysts are lined with stratified squamous epithelium with granular cell layer, and are filled with eosinophilic lamellated keratinous material. The inflammatory response may or may not be present, and in the cysts of long duration, calcification may be seen. The surgical treatment is needed for symptomatic cysts causing interference with function. The treatment requires careful complete excision. Removal of the entire cyst wall is necessary to avoid recurrence. Now let's talk about the different types of dermoid cyst according to the anatomical location. First, we have epibular dermoid cyst, which is found on the surface of eye. Next, we have intracranial dermoid cyst that is found in brain. Next, we have nasal sinus dermoid cyst, which is found inside the nose. And last, we have orbital dermoid cyst, which occurs around the bones of your eye socket. So let's summarize dermoid cyst in three main key points. First, a cavity lined by epithelium containing desquamated cells. Second, content includes mixture of sweat, sebum, desquamated epithelial cells and hair follicles. And the sites are along the lines of embryonic fusion, which is midline of the body or face. So that's all for today. Thanks for watching and see you in the next episode, which is going to be episode E. And yes, if you have still not subscribed to my channel, please don't forget to subscribe it. Till then, bye, take care.